Doctor's Night Out. I am your host, Dr. Kellyann Petrucci, and tonight we have a star-studded panel that I'm so excited. You know, I've gotten so many texts and I've gotten so many emails that said, oh my gosh, your panel, I am so stoked, I can't wait. So I know we have a full house tonight, so we will not keep you waiting, but I want everyone to know all the doctors that you see here on Doctor's Night Out are doctors that I know, love, and trust. These are doctors that are committed, and I can tell you beyond what you're used to. These doctors are committed to their growth and all in the service of you. They are your true seekers. And what makes this show different than a lot of the other doctor shows and a lot of the other programs that you see that have doctors on, these doctors are different because of their commitment to growth, because they're always going out and expanding and serving. Their level of knowledge of the whole body is very different than what you usually see on air or what you usually see in panels. These are very different, spectacular, well-versed doctors. You are going to love them. Welcome, doctors.
Thanks for having us.
Thank you.
Glad to see all of you. So guys, we are short one doc. I will tell you that right now. We're short one doc. She had a little bit of a technical issue, but she'll be joining us shortly. Let me just go through these bios and you're going to see why I love all these women. So Dr. Tami Meraglia, I've known Dr. Tami for a long time. She and I have broke bread a gazillion times. We're always out trying to figure out how we're going to conquer health in our own way. She really is committed. She does a lot with stem cells. If you've ever heard of stem cells, she is one of the pioneers in that area and is doing a lot of other things with COVID. I'm sure she'll talk about. She's really trying to create a footprint there. But she's a medical doctor, a physician with passion to help women take charge of their own hormone health and happiness. Her unique voice is sorely needed today. It sure is. As women face hormonal imbalances and deficiencies before, during, and after menopause. These conditions, which can assault the quality of life, are nothing new. What is new is that they're appearing earlier and earlier than ever before, and at a time when women are already stretched to the limit. So it's going to be so great to hear your perspective. So looking forward to this, Dr. Tami. Dr. Shiroko Sokitch, hello, how are you?
I'm great.
I've known Dr. Shiroko for a long time as well, and she has treated some people that I know personally, and they rave about, you know, what they, when they are on the other side of treatment with her, how much more balanced, how much better that they feel in ways that they never even knew were possible. She's really a doctor who cares about you. She's the owner of Heart to Heart Medical Center in Santa Rosa, California since 1993. Dr. Shiroko is an expert at using many modalities to bring your body to balance and wholeness. Her specialty is healing when it seems impossible. And I can tell you from people I know that have worked with her, they were at the end of the line, and she brought them back. She brings hope and healing to difficult health conditions by blending Chinese and Western medicine with a deep spiritual and emotional healing approach. So glad that you're here.
So glad to be here.
Dr. Gabrielle Lyon, my girl. Dr. Gabrielle, you have seen her before. She's been on our panel. We have done a deep dive with her. I don't know that we've ever gotten so many emails. So, you know, we did a deep dive.
Were they all from my dad?
That I figured that. Dad, mom, cousins, you know, your infant, all of them. So, she has a very interesting perspective, and she talks about, if any of you are challenged and you're writing in because, you know, weight, you have all these problems with weight, and she flipped the conversation around when it comes to losing weight in a way I had never heard, the way I had never seen the science and the practicality behind flipping the narrative on weight loss. You need to know who she is. Dr. Gabrielle Lyon is a Washington University fellowship-trained physician and nutritional science and geriatrics, and is a board certified in family medicine and osteopathic manipulation. She completed her undergraduate degree in human nutrition, vitamin and mineral metabolism at the University of Illinois. Dr. Lyon works closely with special operations military and has a private practice in New York City, which is amazing. In addition, her practice services the leaders, innovators, mavericks, executives, in their prospective field. That's absolutely true. I know that to be absolutely on point. Dr. Lyon brings unparalleled results to her patients with personalized advanced nutritional interventions, metabolic and genetic testing, and behavioral action implementation. She leverages evidence-based medicine with emerging cutting-edge science to restore metabolism, balance hormones, and optimize body composition with a goal of lifetime vitality. So glad that you're here. Welcome.
Thank you.
So you can just tell by me reading these bios that these women, they really do have a different perspective on so much. There's so much wisdom here that I'm actually almost blown away. I'm going to shoot the first question to my girl, Tami. Dr. Meraglia, you know, you do so many different things for women. And, you know, I actually was so impressed with everything that Dr. Tami does. I actually took a trip to Seattle to go see her and to go see her practice because she was doing so many amazing things. I had to see what she was doing. And, you know, just to really have a beautiful afternoon spending time with such a brilliant mind. And so I know that you can help with this question. So if anyone is out there and you're tired all the time and you feel like you have zero energy, I want you to hear what Dr. Tami has to say. Many of us feel that our battery's dead. And of course, the one reason is because we're wearing so many hats. Now more than ever, we're teacher, mom, businesswoman, cook. We've got all this going on. And in fact, it's the one symptom that you said that you actually even experienced. So tell us about this and what are we really looking at here?
You know, I was a regular medical doctor and my patients kept coming to my clinic and saying, you know, I don't feel myself, I'm tired all the time. And, you know, women have a tendency to really give a lot of excuses. Well, of course I'm tired, I'm working. Of course I'm tired, I'm taking care of the kids, or I have an infant, or et cetera, et cetera, et cetera. But I realized that when they kept coming into the clinic, I would run the usual CBC, thyroid, iron studies, and they'd come back and I would tell them they're fine. And I realized that fine is a 4-letter word. And nobody wakes up in the morning and says, gosh, today I want to feel fine. And I realized that traditional Western medicine only had a plan for you if you were sick enough to have a CPT code or an ICD-10 code that matched your symptoms and had a disease name.
So true. But spot on. So what did you do? How did you like work around this?
So I dove in and started researching and started my training as a naturopathic physician. And I learned that the gut and the microbiome and your liver and hormones had everything to do with wellness. And that was that feeling of vitality. And I was in residency when I had a toddler and was pregnant. So I was tired and I was saying all those same excuses. Between patients, I would lay down on the floor. I was so tired. And I thought, well, I'll just run my own hormones. You know, maybe after having 2 babies, I'm just depleted. And for some reason, I decided to run testosterone. And I got lots of criticism, and I was working for a big HMO and they're like, what, is this a mistake? You're not a man. And I'm like, no, I want to know. Turns out that testosterone, we need a little bit, but it has an outsized role in how we look, feel, and function. And it's produced in our adrenal glands after the age of 35. And if you're stressed and you're go, your body just says, I don't need testosterone. And testosterone's the thing that helps your weight, it helps your muscle and your fat ratio, but most importantly, your energy. And when I discovered I could reboot my biology and reboot testosterone without taking it, because I don't want to take testosterone, I was scared of that, then I found my energy, I found my vitality.
You know what, Doc, I have never heard of someone talking about testosterone for fatigue, and it makes so much sense. That's new information. I mean, I hope everyone tapped into that. So just to kind of sideline on that question, is it something that we should get checked for if we're experiencing exhaustion? How easy is it to get tests for? Is it a blood? Is it saliva? And is it easy to get a prescription for something like that?
So yes, and yes. I think that depending on where you are in your life, if you want to have another baby, you don't take testosterone, but you can get 1 milligram of bioidentical testosterone, and it can be a game changer in your life and in your weight. Yes, I actually wrote a book about it called The Hormone Secret, and the secret hormone is testosterone for women. So there's quizzes in that book, and you can kind of tell if you're going to do it. But if you really want to investigate and get possibly a prescription, you should get tested. And you can get tested in blood or saliva. If you're going to do blood, make sure your doctor tests for free testosterone. They'll tell you have normal testosterone because there's a total testosterone. Well, that's like saying, okay, I need a bunch of workers on the island to build a resort. But instead of counting how many workers are on the island working, they're counting how many boats and people are on the boats in the ocean. Who cares? They might not even be going to that island. You need to know who's going to work for you, and that's your free testosterone.
That's fascinating. I just want to thank you for that. And I also wanted to welcome in Dr. Anna Cabeca. Dr. Cabeca, we're so glad you made it.
I'm sorry to be late. I had to reboot. It's a rebooting kind of day, kind of like testosterone reboot.
I had to reboot 3 times, so don't feel bad. I don't know what was happening tonight. So I wanted to welcome you and let everybody know we've had Dr. Cabeca on our lives during the day. We've had her on our panel. She's beloved here. She's an internationally acclaimed menopause and sexual health expert, global speaker, pioneering promoter of women's health. She's an Emory University trained and triple board certified in gynecology, obstetrics and integrative medicine, and anti-aging regenerative medicine, and a USA Today and Amazon #1 bestselling author of The Hormone Fix, and a holistic lifestyle program for menopausal women is what she does. So happy that you're here.
I'm glad to be here and back with you. And what a great panel. My favorite docs all together. I want to just give a big hug.
Yeah, we've been getting so many good responses from this panel. Everyone's so excited. So let's get into it again. So I want to talk to you, Dr. Shiroko, because you do so much. You talk about, kind of plugging people back in with these mysterious symptoms. You do a lot with that. So let's talk about sneaky symptoms and the ones that women might not realize that are actually hormonal symptoms. What are the symptoms that are easy to miss?
Oh, so many, actually. So a lot of women attribute, hot flashes and weight gain maybe to menopausal symptoms, but there are other things like irritability, and memory issues where you feel like you're foggy brained or your memory's not quite what you think it should be. You could have muscle aches and muscle weakness. And a really surprising symptom that actually happened to me was that your ligaments get looser and it's easier to injure yourself. And so I had a dislocated jaw in early perimenopause, and actually went to see a dentist and found out that she said that it was because of hormones. So there's like, if you start feeling like you're spraining yourself a lot more or injuring yourself a lot more, that's a sneaky symptom.
Oh, that's really, I have to say that's very unusual. I have not heard of this. And Dr. Lyon, you say that there's 7 different hormones, and women often only think about estrogen, progesterone. That's true. I mean, that's most of the patients that you talk to, they know about that, but nothing beyond that. So what are these and what's their role?
Well, Tami did a beautiful job of covering testosterone. Let's talk about a little bit about something, one of the hormones called oxytocin. And this is really interesting. Everybody thinks about oxytocin as this happy hugging hormone, also really important in milk letdown, right? And also when you're making love and you're connecting. Well, oxytocin has a role in glucose metabolism, in energy balance. I prescribe it a lot in my clinic as it relates to appetite control. And again, these are new and novel. You take it intranasal and it spreads it to the periphery and to the brain. Mm-hmm. It's really interesting. So oxytocin is not just the hugging hormone. It's helpful in something called cognitive control, which is very, very interesting. Cognitive control is really your perspective and ability to turn away from the light, right? Turn away from the Twinkie. It allows you to have that cognitive restraint, right? So also thyroid And, you know, you had just mentioned thyroid in terms of joint laxity and tissue kind of inflammation. What's really interesting in my clinic, one of the #1 signs that I see of low thyroid is tissue injury, whether it's, you know, all of a sudden I'm getting tendonitis in my wrist and it's repeated in my ankle. A lot of times, because thyroid, while we always think about thyroid for metabolism, is really important for metabolism as it relates to muscle tissue, which I'm sure we're going to talk about, but it also relates to tissue turnover. So that's one. And then, of course, progesterone, which, you know, you had mentioned, estrogen. You know, estrogen is quite like the prom queen, very popular. And there's something about estrogen that I do want to highlight. We always talk about estrogen as it relates to reproduction, but what about estrogen as it relates to glucose homeostasis and, are you ready, energy balance and weight management? So estrogen, although very popular, plays a very pivotal role in weight management. So and then of course cortisol, I don't want to take up too much time, but cortisol is like the redheaded stepchild. Cortisol.
Hey.
I love red hair. In fact, I would
in a good kind of way. We've got all the colors covered
I
here.
would totally be a redhead. So cortisol is really interesting, and people think about cortisol as a stress hormone. Yes, it is, as it relates to you know, adrenals, but it is catabolic as it relates to muscle tissue. So I know that we're going to talk about body composition. I know that we're going to talk about weight management, because hormone balance and weight management all go hand in hand. Cortisol is key. When you have low blood sugar, you have high cortisol. So
and I want Dr. Quebeca to talk about that. Dr. Quebeca, talk to us, because I know you talk a lot about cortisol, and talk about cortisol and how it can, like Dr. Lang was saying, how it can increase our blood levels of insulin and create all kind of problems with insulin resistance, weight gain, all of that.
And hot flashes. We can talk about hot flashes and mood swings and hunger and yeah. So yeah, the cortisol is that life-saving hormone, but too much, too long, it's a problem. Too much, too long, too often, it's a problem, right? And a big problem with cortisol is one reason why I'm always about, okay, we have to manage cortisol, reset our circadian rhythm, our natural night-day cycle. So we wake up, cortisol is high in the morning. It wakes us up in the morning, and that is where we're charged up, ready to go. Those who are listening, who wake up tired or fatigued, hit the alarm clock 3, 4, 5 times, may have that low cortisol in the morning and an imbalance in your circadian rhythm. So we want to modulate that. But also, when cortisol is up for too long, oxytocin goes down. And when we suppress, when our, you know, protective areas of our brain will then suppress cortisol production, we get in this really dangerous state of low cortisol, low oxytocin. And this is what I call the cortisol oxytocin disconnect. And it feels like disconnection. We are burnout. We are feeling isolated. We feel lonely, depressed. We no longer love those who love us. We may say, I love my husband. I just don't feel love for my husband, right? I love my work. I don't feel love for my work. And this is a dangerous place to make decisions. Right? This is a physiologic disconnect. I also call it often the physiology of divorce, and because you don't feel that love, you don't feel that connection. And that's a really big player. And it's certainly a huge situation in weight management, as well as that, you know, cascading cycle. And here with a exacerbation of menopausal symptoms, the hot flashes, the insulin resistance, that typically follows suit.
I tell you, I think all of those symptoms, all that symptomology kind of makes you go inward. It makes you go inward, and it does change the relationships that you have around you as you're going inward. So it's another reason why we really have to work on balancing our hormones and really understanding, oh, this is cortisol. I mean, I think that's the big thing. Out of all these things we're talking about, it's really a matter of having enough connection to yourself, to your body, and getting information like we're learning here tonight, and understanding what's actually going on in your body. Oh,
Yeah.
this is, this is my adrenals. This is whatever it is, really connecting to that. So that's what I want people to do as they're listening to these, some of the world's best experts right now. I want you to understand that once you start learning this information, the connections that you have to your body, they become very different. Dr. Tami, anxiety. Anxiety is a really big deal. And I have never heard ever in all of my life, particularly in practice, I've never heard more people talk about the anxiety that they're experiencing as I hear right now. And I know that you talk about low progesterone as it relates to anxiety. So let me ask you just a couple of questions. Number one, so progesterone, talk a little bit about what it is, what it protects us from, and when the levels are right, what do we feel? And also, how easy is something like this to track, and does it naturally go up and down as we age?
So progesterone, all of our sex hormones as women, they start to leave us out of the ovaries, rather, that production, and they go to the adrenal glands. So that's the secondary backup system. And so progesterone leaves us first, and it leaves us fastest. And that's one of the reasons why they tell us, have your babies before the age of that scary advanced maternal age thing, that the progesterone is progestation. So it is one of the first ones to leave us, and it's been called the Valium that bathes the female mind. So you're actually losing your progesterone in your 30s, and you might not really realize it. You might have been frustrated with your children or your husband's clothing on the floor, but now you want to choke them. Because
you've been at my house. You've been over to my house, haven't you, Dr. Tami?
Well, you've added to the stress cup, right? You've got a whole different situation going on. One of the prime symptoms that I don't think women put together at all of a progesterone deficiency is to wake up between 2 and 4 in the morning wide awake. Like you've never been asleep at all. You just like, why am I awake? I'm not groggy. I'm just awake. So progesterone has so many roles, but it is that anti-anxiety. And one of the ways that you can get your own body to produce more progesterone is to take care of the cortisol. And that's for 2 reasons. One is it's just a crazy system. Not sure why, but cortisol actually blocks the receptor of the progesterone. So when you're stressed, you can't even access your own progesterone natural Valium. So I think that you absolutely need to address your cortisol and your stress head on so that your body can actually dock and get that progesterone. And if you're taking progesterone, be mindful that an oral progesterone actually is going to pass through the blood-brain barrier better than the topical, and it'll give you that peaceful feeling again. And it will allow you to take that breath and not want to choke everybody around you. So how do you heal the stress, and how do you, because, we can't get rid of COVID. You can't get rid of all the governor's orders and get everybody to go back to normal. Well, you can't stop stress, but you can erase it. You can erase it like we brush and floss our teeth. If you leave food on your teeth, it's going to get gum disease and it's going to cause lots of damage the longer you leave it. And you don't stop eating, you just brush and floss and you continue to eat. Well, that's the exact same thing with our cells. Cortisol creates this inflammatory gook all over our cells, and it causes damage the longer it's been there. So what do? You can't stop the stress. You can't. Brush and floss it with meditation.
I was just going to ask, it would make sense if this is so cortisol driven, that can you balance your hormones with meditation? And you're saying you can.
Through the adrenal gland function. So you can erase, you can brush and floss the inflammatory damage and all of that cortisol off of your cells, and you can actually reboot your adrenals. Just think about it. Your adrenal function is affected by what you think and how you feel. And if you don't think that's true, just imagine yourself in your car with a police car with sirens and lights behind you. You have a thought that you're going to be pulled over. And so your eyes dilate, your heart rate and your respiratory rate go up, and you might even have sweaty palms. You have a full-on physiologic body response to a thought, because your mind is the most powerful pharmacist in the world. And it sends messages to your adrenal glands.
Undoubtedly, and it's very well said. But here's a question for you, Dr. Shiroko. I love what everyone's saying, but a lot of women in their 30s, they're going to say, well, I know that I'm hearing what these panelists are saying, but I'm too young. I'm in my 30s. I can't possibly be having any problems with my hormones, or none of these things that they're saying is really affecting me. Now let's get to Dr. Line, where she talks about, how do I lose weight? That's what I care about, because I know nothing else matters, but it does, doesn't it? And someone in their 30s can be having some of the same issues that we're talking about. Some of these sneaky symptoms and such can be related and traced back to hormones.
Well, like Dr. Tami said, stress can cause your cortisol levels to go up. So if you live a very stressful life, and then that can block your progesterone, and progesterone is the first hormone to drop in terms of the perimenopausal things. And so it kind of depends on how stressful your life is, but a lot of people right now especially are experiencing a lot more stress. And moms especially, who are trying to take care of children, homeschool children, and work, and probably take care of the home because people aren't coming into the home anymore to help them. So it's so much is going on, and you can definitely start having perimenopausal symptoms in the 30s. Over my years of practice, even not in COVID times, I've seen hundreds of women who start having symptoms earlier than they might think they should.
You talk a lot about Eastern medicine.
Yeah.
And one of the things that I love about your practice is that you do have East meets West philosophy, and you do combine a lot of these, which is really beautiful for a lot of people. So what are some of the things that someone can do in their home that's this Eastern medicine balancing system that you have?
So I practice Chinese medicine, and there are other modalities of Eastern medicine, but there are many things you can do. One, like Tami said, is meditate. Even 3 minutes of meditation, although science shows that 8 minutes minimal is enough to make a difference in how your hormones function. But even 3 minutes makes a difference. And lots of people think they're too busy to meditate, but if you just set aside 3 minutes, do that every single day, breathing in and breathing out, in a moment of severe stress. I think I showed you this before, but you could do this, hug yourself.
How does it work? That will sound strange to people. I understand what's happening because we went through this, but people are loopy now. Okay, so tell people why this is effective.
Well, for many reasons, but there are some acupuncture points over here that help calm your nervous system. But also hugging yourself does calm your nervous system, and then taking a few deep breaths along with that, it calms your nervous system, it helps your body rebalance, and it can reset your hormones fairly quickly. Maybe it affects oxytocin, although I don't know the science on that, but oxytocin is elevated with a hug and with feel-good events. So maybe that is another element of it. You can also do a thing at the top of your head. This is acupressure, where you can just put your finger like a ½ inch inside of the hairline at the top of the center of your head. Mm-hmm. And that calms your whole entire nervous system, and it relaxes your jaw. So a lot of times when people are tense, their jaws get tight. And their hips get loose, and what you want is tighter hips and looser jaws. So if you just massage that for a minute even, it will change things.
It's amazing. And don't negate these simple things, because don't think of it as too much of an oversimplification, because these simple things can be very powerful. I mean, I talk about all the time what something as simple as lemon water can do. It's really crazy. So Dr. Kebacki, you say it takes more than hormones to fix our hormones, which is kind of bouncing off of what Dr. Shiroko just said. Explain what you mean by that. And you say even if women are using bioidentical hormones, and we're going to talk all about this in a minute, do they need to be doing more?
Yes, absolutely. It takes more than hormones to fix our hormones. Like we know that, right? Because if not, everyone on thyroid hormones would be thin. So it definitely is a complex interaction of hormones. And I would love to say it's all about our, I'm a gynecologist, so I would love to say it's all about progesterone, estrogen, testosterone, even DHEA. But the truth is, really comes to the master hormones. And those master hormones, like the masters of our university, they are cortisol, insulin, and I like to describe oxytocin as the dean of the university. So as we do things like meditation, which increases oxytocin, decreases cortisol, we do things like grounding, getting out in nature, decreases cortisol, increases oxytocin. And the interaction between, we know the interaction between cortisol and glucose can create certainly more insulin resistance and hyperglycemia and inflammation. And that affects all of our hormones in so many ways, and our menstrual cycles, our moods.
I want to stop you. When you talk about grounding, this is a new concept for a lot of people, but they actually are calling it something. When you read research now, they're calling it foresting or something.
Foresting. Yes.
Yeah, it's actually, I've read some actual journals where they're actually identifying this as a real self-care treatment.
Yes.
So explain to people what that is.
Yeah, I actually wrote about it in my newsletter that went out on Tuesday. So yesterday, and because I was foresting, not foraging, foresting this weekend. I did some hammock camping and got into the river and, hiked in the woods and picked blueberries in the shrubs. And I mean, that is a reality because that is something that just totally does reset. We get a lot more than vitamin D from the sun. Right? We get a lot more than vitamin D from the sun. Being out in nature is therapeutic in many ways, and especially in the forest, higher levels of oxygen, ozone, able to take some deep breaths with good long walks and physical activity as well. And then just the energy of being outside. So that is an alkalinizing activity. And I talk a lot about that in my books, alkaline versus acidic activities, mindsets, foods. I mean, there's multiple levels. So foresting, forest bathing, nature bathing, however it makes you feel good.
This is not hippie stuff anymore, guys.
Not hippie stuff, no. Hug a tree.
And you know what? I think this is going to be way, way important in the next 3 to 6 months, because I think that we're all in our effort to stay clean and not get contaminated or infected with a coronavirus. I think that we're sterilizing and killing the heck out of our microbiome. Yeah. I've never seen so much Purell used in my life. So you need to go out and forest and just get your microbiome.
Wonderful point. And we're going to talk about what exactly that means. I want to get to Dr. Lyon for a moment. People are writing in. Do me a favor, do a quick fire and take us through the 7 hormones. Okay, mention each one. People want to know what they are. And then I want you to get to this whole point about protein.
Yeah.
And, because we are very aligned on this, and you say you have to eat the right amount of protein at the right time to actually really ignite these hormones and get them balanced in the right way. And that's very important. So take us through a quick fire, mention 7, and then talk to us about protein and hormones and how they fit.
All right. Are you ready?
I'm ready.
Count. Okay. So we talked about testosterone. Check. You guys got that. Mm-hmm. We talked about cortisol, and this is really important, and I want to come back to this. Talked about cortisol. Talked about leptin, which we didn't talk about, and leptin is a hormone that is released from adipose tissue. It's very important when it comes to weight management.
Fat. It's released from fat.
I'm sorry, fat. What did I say?
Yeah, no, you said it. I just was
released from fat. So leptin is released from fat. Estrogen, we talked about estrogen. We talked about oxytocin. Let's see, there was more on my list.
Estrogen, cortisol, leptin,
progesterone, we talked about oxytocin, we talked about anything else.
I think you've got them.
I think we got it.
Yep, you got them all.
And I think that request came from Jeannie. Jeannie, we can talk about it. I'm listening to this hormone stuff, and I totally agree. And we see all these women suffering, and it's interesting because when you think about what happens perimenopause and menopause, the number one complaint that you hear across the board, everybody, almost everybody, puts on weight. Tell me it's not true.
Can't
Tell
say
me it's not
not
true.
true.
Everybody puts on
a
weight.
single arm that there's not a single hand that would go up.
Right? Here's the question I have for you. What tools, number one, why exactly? And what tools do we have to actually fix this? And I know you know where I'm going about this because it's all going to come down to muscle, right? So we've talked about cortisol. We've talked about insulin resistance as these big, ugly players. Now, what if I told you, and then of course, you know, like the three musketeers, glucose, cortisol, insulin. What if I told you that muscle tissue, I know it sounds crazy, hang tight, muscle tissue is actually the solution. Now, I'm going to break it down. Muscle tissue is responsible for 75% of insulin-dependent glucose disposal. So the majority of the glucose in the body is disposed of by, that's right, skeletal muscle tissue. Now, skeletal muscle tissue in the average person makes up 40% of their weight. So why are we not talking about optimizing muscle tissue as the solution for perimenopausal, postmenopausal weight gain? Are you ready? Estrogen plays a role in glucose metabolism. It plays a role, I'm going to slow it down, ready? I want this all to land. Estrogen plays a role in the muscle's ability to use glucose. Wait, what? Nobody's
Okay,
talking
yeah.
about
So
estrogen muscle.
because now it went over our head a little bit.
All right, okay. All right. So when estrogen is out of balance, the ability for your organ of longevity, that muscle tissue, to utilize glucose goes down. Muscle tissue is at the key and the cornerstone for a lot of these issues that develop perimenopause and postmenopausal because of the relationship of these hormones on this tissue.
And it's the same in the brain.
It is.
Same in the brain.
Yes, it is. Dr. Anna is totally right. When you are talking about energy and calorie regulation, there are estrogen receptors in the brain. There are insulin receptors in the brain, you guys.
And Dr. Tami, you're on board with this as well.
Yeah, and don't forget your heart is a muscle.
And your heart is a muscle. So, okay.
You know,
so
there's a beautiful singer, Karen Carpenter, and she suffered from anorexia and she actually died. But patients who die of anorexia die of heart failure.
And Dr. Shiroko, you believe that protein plays a big part in hormonal regulation and fuels these hormones and gets them going where they need to go.
Yeah, sure do. Yeah.
Because I have to tell you, I just from a personal level, I notice a very big difference in my world all around. I am talking hair, skin, nails, even teeth, fatigue level, weight gain, all of it, if protein is not utilized correctly. So, Dr. Lyon, how much protein do we need to regulate our hormones? And would you go as far as to say that protein is actually very protective and it can even be used as a preventative, eating proper, making sure we're building our plate properly to make sure that we don't go through the hot flashes and through, because it's very interesting to me. You know, for those of you who know my background, I studied a lot through studying Paleolithic medicine, and it's very interesting, or nutrition, and it's very interesting to me that some people get hot flashes and some people don't. It's not genetic. It can't be, because some people get hot flashes, some people do not. And that's curious to me. So can something like eating the right amount of the proper foods, can it even help, Dr. Lyon, with preventing things like hot flashes that people suffer from?
So what I can say is that eating the right amount of protein, and that in my clinical experience and perspective is 1 gram per pound ideal body weight. And this is really important. I want everyone to understand 1 gram per pound ideal body weight. This is on the higher end. And the reason is when you go through perimenopause, menopause, your ability to utilize glucose, carbohydrates, actually goes down. Eating the right amount of protein does one very important thing, and that is maintain your muscle mass. Around perimenopause and menopause, it is striking how much muscle you lose. And muscle is your metabolic currency. And this is very well documented in the literature. And this is a really pivotal moment for women going through any kind of hormonal shifts right around 40s and 50s. This is the time where protein becomes so important. And can it protect against Hot flashes, that I don't know, but what I will tell you is that you have a better chance of optimizing your body composition, lowering systemic inflammation. And if you lower systemic low-grade inflammation, you have a much better chance at everything.
And we talked about, sorry, Kellyann, we talked about this in my stem cell stuff with Dr. Lyon, and she got into my head because she tells you that you have to eat your protein first, and I was starting with my salad, and I was like, oh no, Dr. Lyon's gonna be mad at me.
Well, this is what I want, since we're on this topic, guys, and she got me thinking, I have to tell you, so when Dr. Lyon came on for a deep dive, we did an hour together. It was just absolutely incredible. I hope you all have a chance to catch that one. And Stacy, if you want to write in where they can find that interview. But I have to tell you, the next day I started lifting weights again.
Oh my God, amazing. I did my job, incredible.
Yes. I said, what am I doing? I'm doing everything, but I'm not, because, and I want everyone to hear this. And this is something, that I wrote about when I wrote in paleo fitness and things like, you kind of have to earn your pleasure walks. You kind of have to earn, your light cycling. I love doing that. If I had my way, I would do nothing but yoga and take light walks. I'm not kidding you. But I have to tell you. We can
still be friends, Dr. Kellyann. We can still be friends.
But I have to tell you, I notice an incredible difference in my physique, in my framework. My furniture shifts around. My brain doesn't work as well. I feel younger when I'm lifting weights. And so what I really realized when I started really analyzing this and looking around, I thought, gosh, you have to work out like a kid if you want to look young.
You are so right. And can I add something here? I'm going to add something here. Please. So the natural resistance just as life goes on, just in general, is not to keep, working harder and like doing high intensity interval training. But as the time comes when hormones shift, for everybody, men too, this is actually the time in which you have to offset it by the intensity of your physical activity. So this is the time.
So let's go through.
Yeah, that's
so many more questions I want to ask, and we're running out of time. And I just love this panel. There's so many things I want to ask. I want to get to you, Dr. Tami, because this is something that I want everyone to hear. No one hears this, and it's true. All these studies came out that said, oh my gosh, we are now noticing a correlation between COVID and vitamin D. Your vitamin D levels. You want that sufficiency. And I don't know about you, Dr. Tami, but when I was doing empirical data, I was checking vitamin Ds in clinic. I never saw a normal one. I don't think I ever did. Everyone was low. Everyone was low. And here's why it's even more critically important than we realized. We're noticing that the correlation between COVID, of course, and vitamin D, that's now reported as a truism, but you say it's also a hormone.
Well, it shouldn't be called vitamin D. It actually is a prohormone, and it interacts with over 200 functions in your body. And so it really isn't a vitamin, but I guess they decided it was just too much work to change it. And, I think normal is a setting on a dryer. And what we really want to do is we want to be optimal. And so you need to ask aggressively and firmly and be the CEO of your own health and ask your doctor to order a vitamin D 25-OH. That's 25 hydroxy. So it needs to be at least 50, if not 60, 70, 80. And over 100 is too high. It is one of the toxic ones. But you want to be optimal. It's so important. In weight loss, it's important. In energy, in cancer, in immune function. We could have a whole section, a whole Dr. Kellyann Live on vitamin D and all of its benefits. And it's so easy to find. And I think we're here because we're not outside. We're not foresting or grounding, we're in buildings. And then when we go outside, we're worried because of the thinning of our ozone. We're wearing sunscreen because, when you're a blue-eyed, red-haired freckle face with no ozone, I'm going to get skin cancer.
So, I want to talk about a million things, but I want to shoot it over to Dr. Shiroko for a moment. I want to talk about the role of our microbiome. We don't have a whole lot of time, but I think it's important. How does gut bacteria influence hormones?
Well, everything influences hormones. So gut bacteria also does, because when your microbiome or when your gut is functioning well, then your hormones are better able to balance. And so it helps. So the healthy bacteria help you have healthy neurotransmitters, help your brain function better. And then when your brain functions better, then your hormones function better. And so it's like this cascade of better, happy function.
So I want to start talking a little bit, thank you for that. I want to talk a little bit about food. And that's why I want you to have an understanding of the gut biome. And what I want everyone to know, I mean, the best, and if I can just kind of recap, there's so many connections with the gut biome, with our brain, pituitary, with immune function. There's so many interconnections. Just know that, and just know that we have to get that part of our body really right, because there's so many inner workings. It's like, kind of like the dendrites. It's like, it's just very synaptic and very connecting to so much of us. So,
and the science is so new. I mean, this is an emerging field as it relates to obesity and hormones.
And I love that there's so much research on it. Now, I had first learned about biome and microbes and all of these things, and how we're really bag of bugs. I learned about this way back. And nobody knew what the heck it was. I learned about it in Europe, because, as most of you know, I was trained in Europe. No one knew what this was. And it's so fascinating to me. You can pick up the New England Journal of Medicine, I mean, the most prestigious clinical journals, and they're talking about the gut biome. So we know it to be true. And so let's talk, because this, let's hack this down, because I'll tell you what everyone wants to get out of this. We have very little bit of time left. They want to know, guys, what hormones should I get checked for? How easy is it? How hard is it? And what should I eat? That's what they're going to want to walk away from, they've gotten the base knowledge. So I'm going to go around to everyone. And what I would like you to do is tell me kind of your take on hormones. Would you like, what kind of hormones do you like people to use? More natural version? Or do you think, I know some doctors that say, phooey, let's just do the hardcore stuff because it's the only stuff that works. There's all kind of philosophies. And take us through. And Dr. Quebeca, I'm very interested about your keto green, because it's a great diet. I love what you do with hormones. You know this. So I want to go through some of that as well. Dr. Tami, let's start with you and your sophisticated knowledge. Tell us what people, so of course you can't see these people. You see so many people in your clinic, and I know you've got several clinics now. So if you can't see people, but what would you say is a generalization? Well, how would you guide people?
Well, that's why I wrote my book, The Hormone Secret, because doctors are really minimizing the requests of women to get a full panel, a full look at what's going on. So you really have to be comfortable before you go to your appointment to say, this doctor works for me. And if they're not working for me and with me, I can fire them and I can go find somebody else, because you need to get your thyroid checked, at least a TSH and a free T and free T4, but probably reverse T3 as well. You need to get your estrogen checked, which is a good estradiol, progesterone. We talked about free testosterone. That's the key, free testosterone. You want to get your cortisol checked. You want to get your DHEA sulfate checked, because that's a really good indicator of how your adrenals are working. And don't forget insulin. I have a lot of people who that's the first sign of prediabetes, is a super high elevated insulin. And insulin's like an old dog. It knows one trick: take what you eat and store it as fat. So we don't want a high insulin. It's pro-inflammatory. And then the vitamin D. So there's some clinics that have blood spot tests. But your doctor should order this for you. You are not asking something outrageous to look under the hood of your car before it starts smoking and clanking.
I love that. And just give me a general, Dr. Tami, because you're so, you always look so beautiful. What do you eat and what do you recommend? And a lot of these women, you're looking at women on the panel, but they are movers and shakers. So everyone, these people, they have children, they're working in clinic, they're doing a million things. They're always, like I say, committed to growth. I'm not kidding you. We are always somewhere. Are we not, ladies? We are always somewhere. So you always have high energy, Dr. Tami. You always look amazing. She's a former ballerina and her body still looks like that. So talk to us about what would you recommend as a general for people to eat?
I think that you really need to remember that what you eat is one size does not fit all. I think protein's about the only recommendation that everybody can have a take home, but even that, if you're a vegan, you have to filter through that, and if you're a vegetarian, but protein is, and more plants, more vegetables. But if you're trying to get a stem cell treatment or activate your stem cells, that's going to be different than if you're trying to lose weight. And that's going to be different if you're perimenopause compared to postmenopause. So I'll be 55 next month.
Unbelievable.
Double nickels.
Unbelievable.
And if you have true on adrenal fatigue, this fasting thing is a terrible idea. Your adrenal glands are supposed to support your blood glucose levels. And if you let your blood glucose levels go down, it's an emergency for your adrenal glands and they go into freak out mode. So I think there's huge science behind fasting and intermittent fasting and the benefits of it. But just because it's right doesn't mean it's right for you. So I eat protein in the morning. I do think that a lot more people can enjoy eggs than they think. It's not, it is a myth about it being
Absolutely
the cause of cholesterol. And there's an ingredient in the yolk called choline that is really beneficial for your adrenal glands. So don't you dare have a white egg, the white omelet.
And it's also a fat transporter. Choline, it's a fat transporter, will not hang around where it's not supposed to. Choline,
God meant us to eat the whole thing.
Right.
Yeah. But I also think that we're not eating enough vegetables. So I'll get like a yam and I'll put my poached egg on top of my yam.
It's delicious.
And some avocado. And that's breakfast. And I think that what we have to do is we have to remember to prepare. I do have frozen berries and protein at my work. I have Dr. Kellyan's bone broth in my freezer instead of an afternoon coffee. And then make sure that you're getting a dinner that looks like 75% of it is vegetables and proteins. And if you want a treat, if you want that mashed potatoes, or I'm married to an Italian, his amazing pasta, then fine. It's the little treat, taking up, a quarter of your plate.
It's an accessory, not a meal. Beautifully said. Thank you so much, Dr. Tami. Dr. Lyon, question, same thing goes to you. I want to know a little bit about, what you eat, but and I have another question because this is so carved into your expertise. What about someone who does feel a little bit of adrenal fatigue? Should they be working out like we talked about, like working out hard and heavy? Is there some kind of middle ground? And talk to us about, fueling ourselves. And again, this woman, by the way, just had a baby. She just had a baby. She's even got like cheekbones. That's not fair. How does this happen? It happens because she knows something. It happens, guys, because she knows something. So go ahead, Dr. Lyon.
That's a really interesting question. It really depends on the level of fatigue you're talking about. So taking care of a lot of women that have gone through fatigue and have gone through hormonal imbalances, it's really a slippery slope. It depends on any kind of underlying issues. So what I will tell you, what I find often is by targeting your energy. So it's not about low quality, low grade activity. I would rather women do less training and the training that they're doing be very high intensity because it's not sustainable. So you might do 20 minutes 3 times a week of high quality interval training, allowing recovery on the rest of those days and time. And then just like you said, Dr. Kellyann, earning your walk, earning your leisure walk. The problem that we're seeing with an inability to control body fat and body composition is because we're not training hard enough, smart enough. And that is really important.
That is the key.
Yeah.
So just give us we know that, we know about protein. Give us a real quick rundown. Again, she's extremely physically fit. If you saw her, you would not, I will go as far as to say it's not fair she looks this way after having a baby. But give us a quick rundown on some food. We're very limited in time.
Okay, so I'm going to be really quick here. I love everything that Dr. Tami said. You have to anchor your plate in protein. If I were going to think about percentages, I am thinking 50 to 80, probably 50% plus protein. Carbohydrates require a meal threshold. I don't want you guys to, go crazy with the carbs, but anchoring your plate in protein, making sure that it's protein leveraged. That's number one. A minimum of 30 to 50 grams per meal.
What does that look like, 30 to 50 grams?
So that's about, so that is anywhere from 5 to 6 ounces.
Okay.
And that's hefty for people. People are thinking, man, that's a lot. But I'd rather you eat your protein and under eat your carbohydrates because the body can generate its own. And this is so important to understand.
And protein first.
Protein first because it has a satiation effect. When you prioritize protein, you are much less likely to overeat. Mm-hmm. And when your hormones are out of balance, your feeding mechanism is driven by other things other than physical hunger.
Well said.
That's a really good reminder when we're at home and we think we're hungry. And my kids are like, I'm hungry. And I said, that's because you didn't have any protein.
Always. It's always the answer.
Mm-hmm. Do you want to know the true test of hunger? If someone is really hungry and you say, go eat that dry chicken breast, and then they go, okay, they're hungry.
They're hungry. That's like all the, doing all those competitions that people do, eating the boiled chicken, everything else. Dr. Cabeca, let's shoot to you. I know you have Keto Green. We're limited in time, but I'd like people to know what you would recommend for them. Of course, sight unseen, but what would be a kind of a basic prescription you would give?
Yeah, I definitely want to hit on that. And especially when it comes to foods to increase the healthy gut microbiome. I shared a recent article that was published in Cells in the chat box here on breast cancer and microbial count. So we know that breast tissue with lower microbial count, guts that have lower microbial count, we have higher incidence of tumor grade and tumor breast cancer incidence. So that's really, really powerful. And so I think one of the things that we do in Keto Green, so that my book, Keto Green 16, it's 16 hours intermittent fasting, 16-day plan with incorporating these Keto Green foods. So I agree, healthy protein, high quality protein, right? That makes a difference. What we ate makes a difference. And so also healthy fats. We need fats for healthy hormones. Women in my generation, I'm 54, I'm catching up with you, Tami, 54 with a 12-year-old, this is the challenge. This is fun. And what we were told in our generation was all the low fat movement. The low fat movement, so working with women perimenopause through postmenopause, that it is often reconditioning. We need to add in those healthy fats, the healthy oils, olive oil, avocado, but good old fat. We need that in our diet too. And then alkalinizing greens, and that can be greens, but herbs. And I also want everyone to add fermented foods like kimchi and sauerkraut. We need those to help support our gut microbiota. And as we get older, because of the brain's ability to use glucose for fuel diminishing, we have to switch at least on an intermittent, if not regular basis, to ketosis, so that we can use ketones for fuel in the brain. And that makes a huge difference.
How often, Dr. Cabeca? How often?
I have a rule. It's a kind of my rule of thumb, and I've got to do some science behind this, but my rule of thumb is 10% fasting, 80% keto green, 10% feasting. So that's kind of play with that, but kind of bounce in and out of ketosis, and enjoy your life, right? Enjoy the foods that you love, enjoy the people you love being with, and do it with that healthy intention. And so that's what many of us need to work out.
And I think along what you said, Dr. Cabeca, and what Dr. Shiroko said, I think the gut biome has a lot to do with this, because what I have found with patients, and when I did the bone broth diet, we did 3 tests for 3 different cities, tested a lot of people. And when the inflammation is out of the body, when that head to toe inflammation is down, when the gut is healed, when you learn to become a natural fat burner, when all these three things are in place, what happens is you can have these food accessories once in a while. You can have them, that 10% you're discussing. Because if these things are not in place, it takes you down. But once you get that armor around you, then everything falls into place. Dr. Shiroko, we are limited in time, but we really want to hear some of your lifestyle principles and practices, a basic prescription that you can give to these folks that are listening, of course, sight unseen, but what would you like them to know?
First of all, my favorite thing is to tell people to love themselves more. In my book, The Healing When It Seems Impossible, 7 Keys to Defy the Odds, the first key is love. And when you bring love to the equation, whatever you're going through, it makes it more impactful. And love raises your oxytocin. And when you have more oxytocin, everything functions better, including your guts and your microbiome.
What foods do you recommend avoiding if you have hormonal issues or you're heading that way, Dr. Shiroko?
Well, sugar is the main thing to avoid when you're having hormone issues, although I make an exception for chocolate that's really high in cacao content. So 70 plus cacao with natural sweeteners doesn't raise your blood sugar and doesn't seem to have as bad an impact as other kinds of sugar. So, but